Also serves as coordinator of the Department's World Trade Center Health Programs. Prior to his appointment as director of NIOSH in 2002, Dr. Howard served as chief of the Division of Occupational Safety and Health in the California Labor and Workforce Development Agency from 1991 to 2002. Dr. Howard.
Thank you very much, Congressman Norton, and I'm pleased to be here to provide an overview about the efforts by the National Institute for Occupational Safety and Health to prevent work-related injuries and illnesses to public safety workers like police officers, emergency medical technicians, and firefighters, and also to the Transportation Security Administration employees. Public safety workers are called upon to respond. The HHE program has received 218 requests to investigate potential occupational hazards amongst public safety workers and among TSA workers. These requests have concerned indoor air quality, heat, noise, infectious agents, lead, carbon monoxide, musculoskeletal issues, diesel exhaust, radiation exposure. Between 2002 and 2003, NIOSH received 3 HHE requests from TSA baggage screening employees at the Cincinnati, Honolulu, and Baltimore airports, which focus on potential exposures to diesel exhaust, dust, noise, hazardous items found in baggage, and to X-rays from baggage screening machines. In 2003, NIOSH received also a separate request from TSA management to determine the levels of radiation emissions from various TSA screening equipment and to determine whether routine use of dosimetry is warranted. NIOSH responded by conducting an extensive field evaluation. The objectives of the evaluation to assess work practices, procedures, and training, and also to provide criteria for future actions. NIOSH observed the work practices and procedures followed by baggage screeners and conducted tests of around 281 screening machines to detect X-ray emissions. NIOSH found that nearly 90% of the TSA baggage screeners received no measurable occupational X-ray radiation exposure. None of the participants' doses exceeded OSHA's permissible exposure limit of 1,250 millirem per calendar year quarter, nor did measured doses exceed 25% of the OSHA quarterly limit, which would have required routine employee monitoring. However, there were a few employees that had small measures of exposure. NIOSH attributed the radiation exposure to improper maintenance of machines, to equipment design limitations, insufficient training, and improper work practices. NIOSH made several recommendations to address each of these issues, including conducting monthly or quarterly dosimetry targeted at specific airports for a year to further evaluate the radiation doses obtained in the NIOSH evaluation. NIOSH also encouraged employees to notify their supervisors about equipment malfunctions, to use proper equipment to clear bag jams in screening machines, and to avoid overriding the machine's safety features. As new technologies and products are brought into the workplace, NIOSH will continue to assess their impact on work-related injury, illness, and disability through our research and prevention strategies. Thank you very much, and I'm pleased to answer any of your questions.
Thank you, Dr. Howard. Shelby Hallmark has served as Director of the Office of Workers' Compensation Programs at the U.S. Department of Labor since 2001. From 1990 to 2001, he was the Office of Workers' Compensation Programs Deputy Director with stints as Acting Director. He has served in numerous capacities within the Department of Labor since 1980. Mr. Hallmark.
Thank you, Congresswoman Norton. I appreciate the opportunity to discuss OWCP's role in providing benefits under the Federal Employees Compensation Act, FECA, to injured federal workers, including those in high-risk occupations. The Secretary of Labor is fully committed to ensuring that all injured workers receive the care and compensation they deserve through the services that we provide. We are aware that some of our fellow feds are subject to unique risks, and we're proud that our program provides comprehensive support for those who need it. Under the FECA, we provide compensation for wage loss, medical care for on-the-job illnesses and injuries. We facilitate return to work upon recovery, and we pay benefits for survivors. FECA covers 2.7 million federal and postal workers around the world and some others. It may be the largest self-insured workers' compensation system in the world. It's also perhaps the most generous workers' compensation system in the world, paying 75% of the injured workers' date of injury gross salary tax-free. In addition, FECA does not arbitrarily limit the duration during which benefits may be paid, as some state systems do. It has no meaningful maximum benefit cap, whereas most states limit compensation to an average weekly wage or a figure of that nature. And its eligibility rules are liberal. For example, there are no arbitrary exclusions for particular disease conditions, and the statute of limitation rules are claimant favorable. Perhaps most importantly, FECA is a non-adversarial system, meaning that the employing agency, which ultimately covers the cost of benefits, has no standing to appeal OWCP's decisions. Only the worker is a party to the claim, and OWCP examiners make objective decisions based on the case law and the facts in the individual case, with no motive to limit costs. In the year ending June 30, 2010, the program paid out nearly $2.9 billion in benefits. We accepted roughly 86% of all cases filed and rendered a decision within our target timeframes in the overwhelming majority of cases. But there are some cases which are difficult for the claimant and for OWCP to adjudicate. Traumatic cases of slip and fall and accident, for example, are approved more than 92% of the time, and usually within a few days or weeks. But occupational disease claims receive an initial approval only about 52% of the time and may take a few months to decide. A pulmonary condition, for example, can be much more difficult to ascribe to specific causation factors than a traumatic incident. If evidence submitted with an initial claim is insufficient to accept that case, the claims examiner will explain what is needed to establish the case and may assist the claimant in gathering medical evidence directly. Roughly 1/3 of those occupational disease cases which are turned down result in the claimant returning with more information, usually with more medical evidence, and being successful in perfecting their claim. But fundamentally, these outcomes reflect the fact that occupational disease cases involve murkier situations where the cause of the illness may be ambiguous. OWCP strives to get the right result in every case, but we recognize that no system is perfect, and we continue to work to improve our processes so that each claimant receives a fair, accurate, and understandable decision, even if it's not the outcome he or she might have preferred. Providing more information and access to claimants, employing agencies, and medical providers has been a high priority. We already have case status information available online. In 2011, we'll launch an interactive web-based system that will, for the first time, allow claimants to file their claim forms directly with OWCP and allow them and their agencies and their doctors to upload evidentiary documents directly into the OWCP case file, thus speeding the process. During 2011, we will also implement a greatly enhanced telephone system that will allow our staff to communicate more effectively with workers and deliver improved services. I'm very excited about one other major project, the one that you mentioned, Chairwoman Norton, the President's Power Initiative, protecting our workers and ensuring reemployment. He announced that on Monday. He directed the agencies to work to make federal workplaces safer and to improve FECA case outcomes. OWCP and the Occupational Safety and Health Administration at Labor will work together with all the federal agencies to reduce the incidence and severity of on-the-job injuries, speed claim filing, and help people get back to work more effectively. Establishing those kinds of goals, measuring them, and analyzing results has been shown to yield positive change, and we believe Power will save lives, dollars, and federal productivity over the next 4 years. I'll be pleased to answer any questions you have. Thank you very much.
Thank you, Mr. Hallmark. Jill Seagraves is the Director of Occupational Safety and Health and Environment, as well as the Radiation Safety Program Manager for the Transportation Security Administration. She began her career, she began her occupational safety career 26 years ago with the Department of Army and has worked in a variety of positions in both the federal government and the private sector. Ms. Seagraves.
Thank you, Congressman Norton. I'm pleased to be here today, and thank you for the opportunity to discuss TSA's Occupational Safety and Health Program and the key initiatives we have implemented to promote a safe and healthful work environment for our employees who occupy the front line in protecting our homeland, and to address the recommendations outlined in the National Institute for Occupational Safety and Health NIOSH study, Evaluation of Radiation Exposure to TSA Baggage Screeners. I'm a certified safety professional with over 26 years of occupational safety and health, as you mentioned, and in working with the TSA since January of 2003, was part of a team as the startup of the Occupational Safety and Health Program. The Occupational Safety, Health, and Environmental Program is TSA's major program office responsible for all safety and environmental activities, including policy development, program support, and technical assistance to airports, field units, and TSA headquarters personnel. In March 2003, TSA submitted a health hazard evaluation request to the National Institute for Occupational Safety and Health to perform an independent study to determine the levels of radiation emissions from the various TSA screening equipment and whether routine use of dosimetry was warranted. This request was based on employee concerns about exposure to X-rays from the carry-on and checked baggage screening systems. Over the course of the following months, TSA coordinated closely with NIOSH investigators to discuss their findings and implement recommendations for safe work practices, radiation safety training, and equipment design and maintenance. A key finding was that none of the participants' radiation doses exceeded the Occupational Safety Health Administration's criteria above which employee dosimetry would be required. However, NIOSH recommended TSA perform an additional radiation dosimetry study for at least a year to evaluate the differences observed between airports and to address deployment of new systems. In April 2009, the NIOSH recommended radiation dosimetry study commenced at 6 airports. Preliminary results reveal that TSO's exposures are well below the criteria that would require TSOs to wear personal dosimeters. Today, all of our procurement specifications and engineering reviews of new screening technology consider the safety of our employees. Technology is only deployed once we have certified that it is safe. We work with organizations such as the Food and Drug Administration, the National Institute for Occupational Safety and Health, Federal Occupational Health, the National Institute for Standards and Technology, and the U.S. Army Public Health Command for technical reviews and independent evaluations. TSA's occupational safety professionals routinely visit our nation's airports to provide support and address safety concerns. Workforce training to enhance both the safety of the employees and the security of the traveling public has taken center stage in building a mature, skilled, and professional workforce. In addition to formal training programs, employee outreach has expanded through the use of social media and online communications, allowing us to quickly transmit information on a variety of issues, including worker safety, to our employees, and to receive feedback from our employees through TSA's Idea Factory, Blog Central, and the National Advisory Council. TSA not only maintains a high level of safety for our workforce, but continues to focus on innovative ways to raise the bar. We are working to create and sustain a culture of safety at TSA where employees feel a sense of responsibility for their own safety and that of their colleagues and the public. The National Advisory Council, with the support of my office, has launched I've Got Your Back, a campaign to promote safety awareness. Working together, it is our goal to provide the safest work environment possible to enable TSA employees to focus on their mission of keeping the American traveling public safe. Our safety and health initiatives, training programs, and internal and external partnerships have fostered a safer working environment for TSA employees. This is demonstrated through federal performance metrics for safety and workers' compensation programs. The total case rates for injuries and illnesses and those cases that result in lost workdays reported by TSO in this fiscal year are approximately 80% less than the rates reported in fiscal year 2005. These improvements have led to workers' compensation cost savings of more than 25% over the same time period. I have been privileged to serve as Director of TSA's Office of Occupational Safety, Health, and Environment and to develop a comprehensive safety and health program. TSA recognizes that its strength as an organization depends upon the safety of its workforce and that its mission is as a risk-based, intelligence-driven agency is measured not only by its protection of the traveling public, but also by its commitment to protecting the safety and health of its workers. I thank you for this opportunity to appear before you today, and I look forward to answering your questions.
Thank you, Ms. Seagraves. Let me begin with Dr. Howard. Dr. Howard, I was interested in the part of your testimony involving observers who recommended that 6 machines be taken offline because of potential exposure. I wonder if these employees were informed of this potential exposure at the time. Were they advised to see a physician? What disposition was made of the employees now that we're dealing with the machines?
The overall study involved about 850 workers. And it wasn't an entirely negative study. There were 2 workers that had doses that came close, actually exceeded the monitoring threshold that, for instance, the NRC has for a routine dosimetry program. In 13 of the 854 workers, they exceeded the monitoring threshold for DOE. So our recommendation was for TSA, and there's a lot of limitations to our study. First, these were volunteers and several other things. So we asked TSA to look at...
Who were volunteers, Dr. Howard?
These were study subjects, and we asked them, would you like to participate in the study? So then our recommendation was, given those limitations...
So why was that a limitation?
It was a limitation because we didn't have everyone who was exposed.
So it's not a scientific...
Not a totally scientific, sort of like a medical investigation to look at a volunteer study. We didn't enroll everyone in it. So we were somewhat concerned about the representativeness of the entire population. So the major recommendation we had is for TSA to take a year and do a more thorough study so that we would be able to establish what exposures were actually occurring. So in response to your specific question, those individuals that were part of the study, subjects that had elevations above 0, and there were very few of those, they didn't get to the level where we would have recommended they see a physician. They were still very low levels, and in fact below the level in most cases where we would even have recommended a dosimetry program. So we wouldn't have recommended medical evaluation.
So you found no exposures that were particularly harmful then?
Not particularly harmful, but we were concerned because the study itself was lasted only a short period of time, and most of the recommendations are a quarter of a year or a calendar year.
What's to keep a study, a random study, from being done?
I'm sorry?
What is to keep a normal kind of study from being done? Why do you have to go and ask for volunteers?
Well, our particular program, the Health Hazard Evaluation Program, is not a research study. It's in the characterization of a public health surveillance study.
I don't understand that, Dr. Howard. If it's going to be valuable to you or to us in evaluating what should be done, why not do it the way every other scientific study is done? Would there be any reluctance of people to come forward?
Right. If I could explain it, it's a requested type of evaluation. So it's not a research study per se. It's a requested evaluation, a quick, tell us what the problem is, and so we can better define it. So it's not a research study in the way that you're thinking of it. It's an evaluation program. So it's more like
I hear you, Dr. Howard. I don't know how to evaluate it, though.
Right.
If we have a bunch of volunteers not randomly selected, if we don't have the usual control group, so it would be hard for me to see even the value of such a study, frankly.
Well, the value is we found some workers whose exposure came close to that requirement by a number of federal agencies that say you have to have a routine dosimetry program. And so our recommendation was, TSA, you need to follow this up and do a more thorough study with more employees.
Although those were the ones you saw, the volunteers, who knows, they could have been young people who were never exposed to anything because they're just not old enough or haven't been there long enough. You found nothing that you would ask even your own family to go see a physician, and so now all you can tell them is, why don't you do a real study? And I don't know why they didn't do a real study to begin with, especially since there was a concern that had been raised.
Right. It's a program that is designed to quickly go out and identify conditions in order to follow up on them.
I hear you, Dr. Howard. If there had not been concern raised, and it seems to me, why take all the time to do studies where concerns have been raised? I hear you. If I were working in the agency, I must say, as one potentially exposed to such harm, I would take no comfort from such an evaluation, and can only wonder why the agency didn't want a deeper study.
And we're certainly happy to do that.
I understand that. You are the messenger. The real question goes to the agency. What are you afraid of? You know, if you want to know, then know. Don't dance around the issue. I tell you, this is how people get liability. Speaking now as a lawyer, how you get liability is you had enough sense of concern so that you should have done a real live study when you should have done it, and you didn't, and now I have some exposure, me, the TSA employee. That's what you get. When you don't act, the agency, of course I'm speaking, does not act proactively. Mr. Hallmark, as you're aware, we have just done a historic health reform bill, passed something that the country has needed for 100 years. The subcommittee has heard from employees, this is very troubling, who indicate that they face large out-of-pocket medical costs, including hospital bills, while waiting for your office to process their claims. I'm not sure what they would do if they didn't have the funds. What do you do? What's your recommendation for these workers who are simply waiting to be processed on how they should deal with their own providers demanding payment for services rendered? I understand that of course some cases may be complicated, and you yourself have testified about the difference in cases with some occupational diseases and different from a traumatic injury on the job, for example. But some of these cases were clear-cut on-the-job accidents that were witnessed by multiple individuals. How can you explain the delay that caused the employee to either make out-of-pocket payments or risk losing perhaps the ability to be reimbursed by the provider?
Well, without knowing any of the details of the cases that you're referring to, Congresswoman, I can't directly explain.
Well, can you? Is it your view that there is no delay in these kinds of ordinary kind of traumatic on-the-job accidents?
Well, I would say, as I suggested in my remarks, there are always complicated cases. Some of them, a lot of the complicated cases have to do with occupational disease.
So you think those complications may mean that no payment is going to be required at all? Is that what you're saying?
In the circumstance when we're making an initial determination about the acceptance of a claim of the original injury, we have to make a determination that in fact the injury meets all the criteria for coverage under the FECA. Oftentimes there are complexities, even with on a traumatic case. You mentioned situations which were witnessed, so I take it it's individual traumatic events. Even in those circumstances, there can be complexities about whether the activity was in fact covered. I don't know. I don't know the circumstances of the case you're talking about, but we can have some delays in those cases while the case is still being adjudicated. We would not be able to make a medical payment.
Of
So-
any kind during that time.
If we haven't accepted the condition, then we have no ability to make the medical bill payment. The circumstances, we try to move very quickly.
Are such on-the-job witnessed accidents normally turned down?
Not at all. As I believe my testimony indicated, we approved something like 92 or 93% of all what we call traumatic incidents, which is any kind of an injury that happens in one day. So the vast majority of those cases are approved. There are some which are not approved for reasons
So if an
which
employee
may be
came to you,
specific.
Mr. Hallmark, and said, I don't have any more ability to make outlays on my own behalf. I'm an employee who has been a good employee. What would you advise that employee?
With respect to paying medical bills
Right,
while the
waiting for
case
the
is pending?
agency. Yeah.
It would be my expectation that in most cases, providers are willing to wait, and/or the employee's health benefit program could be convinced to make payments. We often reimburse Blue Cross or other health benefit programs for payments made for a case which later is accepted as work-related, but which was not accepted at the time. So there are ways to address those issues. But from an OWCP perspective, our primary goal is to get those decisions done very quickly. We adjudicate the vast majority of cases within our time frames. For traumatic cases, our goal is 45 days. For occupational diseases that are relatively straightforward, our goal is 90 days. And for complicated cases, it's 6 months. We meet or exceed those goals in an overwhelming number of cases, but in all programs of this kind, there are cases that are outliers, that are on the edges, where a series of complexities come into play, and those are the ones that sometimes cause these kinds of difficulties.
Understandable, Mr. Hallmark. In such a case, while you are processing, would it be appropriate, or indeed does it occur, that the agency is willing to assist the employee so that the information that the claim is being processed is understood to be a good faith one? I mean, I'm giving my my insurer, my servicer, my story, and I don't have any more money to pay. I'm only asking because I accept your view, especially given the number of days you're describing, that the agency is in fact in the process. But all we have now is this person who can't front the money anymore. I certainly am not asking you to say, hold it, we're coming with the money. I am saying this is an employee of the agency with a good record and no money. And is there some way you can assist this employee so that this employee is credible when she says that this on-the-job accident witnessed by 6 people, I'm still waiting X number of months? Is the agency have any obligation to assist this good employee?
By the agency, do you mean OWCP or the employing
whoever's
agency?
yes, the
Right,
processor.
Okay. There are provisions.
Or if you think the agency should do it, I'm looking for some way
Yeah,
that
I hear you.
this employee is going into bankruptcy waiting
Right.
for you to process their claim can somehow get some assistance.
There are certain circumstances in which the employing agency can issue a form that provides authorization for a brief period of time. I think it's up to 60 days, I believe, for medical benefits. In the case where it's not disputed that the injury has been work-related, an auto accident, for example, the employing agency is supposed to issue the CA-16 to the injured worker. They can take it with them to the emergency room or to a physician, and that provides, in effect, a guarantee that there's going to be payment made for
So
that
that's
medical.
kind of an instant,
Right.
a situation where it was instantaneous guarantee, and of course, I'm simply going the record that's before us. You don't have any such, you have witnesses perhaps, according to those who have been in touch with the subcommittee, but you don't have an indisputable matter with respect to how much compensation is due.
Well,
And the initial outlay, if you have, I don't know, Blue Cross Blue Shield, is probably not going to be a problem for the servicer in the first place. It's when it gets old and time goes on and the employee has no funds that the concern is raised that I am raising.
Well, as I said, I believe it is typically the case that healthcare providers like Blue Cross would reject or not pay a case if they know that it has been filed as a workers' comp claim. I believe,
of course, I'm sorry. Yes, that's true.
I believe there are circumstances of the kind that we're talking about now where there could be communications to allow that or to ensure that the Blue Cross or whoever the carrier is in fact picks up those payments because the workers' comp benefit is not flowing. So my assumption is that in those kinds of cases, what we need to do is communicate more effectively between OWCP and the injured worker, and in some cases with the medical health provider, as well as with the employing agency. But as I say, there are going to be cases where, in fact, there is a dispute. Perhaps the agency, even though the event was witnessed, the agency may not believe that, in fact, it was a work-related event.
Well,
And
I
so we have,
appreciate your I'm sorry. I appreciate your response. Well, the question I'm raising is basically when it goes to communication, and to, of course, the burden that the agency may or may not have, but which the employee has no matter what the decision is, and to the extent that communication so that people know it's being processed, all to the good. And the reason I raise it is because there have been complaints that were transmitted to this subcommittee. Ms. Seagraves, now, as to CSA employees, there have been reports to the subcommittee of employees who make it difficult to apply for Federal Employee Compensation Act, or FECA benefits. The kinds of examples they have offered include refusing to provide the necessary paperwork, talking employees out of applying for compensation, and not allowing employees to seek medical attention. Would like, understand how when somebody comes to talk to the agency that there are questions to be asked, and perfectly legitimate questions, but are you aware of these occurrences?
Madam Chairwoman, unfortunately, I'm with the Office of Occupational Safety and Health, and that would be a question to pose to the Office of Human Capital's Office of Workers' Compensation Programs.
I asked you if you are aware, Ms. Seagraves.
I'm not aware of that. No, I'm not.
So you've never heard of people, you don't think perhaps training might be necessary by your agency for TSA managers and supervisors who receive some, are you troubled by this?
Again, I've not heard any of this information, to validate that and to comment.
And you saying who has heard it is who?
I'm saying that in my capacity, I've not heard of these issues.
Who would have heard it?
Again, our Office of Human Capital, Office of Workers' Compensation Program. Now, what I will say is that, we do have communications set up, so for employees to voice different issues.
I'm sorry, would you say that?
We do have what I think is a pretty robust communications program for employees to raise issues.
Mm-hmm.
But again, in my capacity from the occupational safety health side, I've not heard of those claims or those concerns.
Well, that was one that stood out for me. Are the results of the radiation surveys that are performed on TSA equipment posted? so
Well-
that employees have access to these results?
What we do is instead of posting the full packet, on a system, we do provide what we call a radiation safety survey sticker. And so it informs the employee that when the survey was done and when the next one is due. However, at any time, they can request a copy of the survey for their review. So it is available. It's just not something that's put right on the system.
So it's available, there's a sticker that, and
Yeah, it's mounted on the systems, yes.
Dr. Howard, your observers apparently did observe some unsafe practices, poor work practices. What should TSA be providing its employees in terms of training and equipment to deal with the unsafe practices you found in clearing, for example, bag jams?
Employee training is really a vital link in protecting employees, and it's the employer's responsibility to make sure that the training program covers all of the issues and is effective. The employees understand the issue, and so they're empowered to be able to make the changes themselves, because oftentimes workers are not directly supervised every minute of their job. For instance, one of the practices that we noticed is unjamming a baggage jam. Oftentimes, passengers will push their bags through, they'll get stuck in the machine. And one of the administrative controls we recommended is for employees not to be putting their arms into the machine to extract baggage, but rather to use an instrument that would protect them from that. So that's a very simple type of procedure, but it requires training, it requires reinforcement of that training. So that's an important recommendation to protect employees from that particular practice.
Thank you. Yeah, some things are very common sense, but you got to be aware of them. Mr. Hallmark, very good to hear of a reduction in the total injury case rates and lost injury time. Could this partially stem from agencies reporting fewer injuries and not solely from increased focus on workplace safety? We're not trying to take credit from whatever focus that has been, but going back to the question that I raised initially with Dr. Howard, we need to understand as much as we can about changes that we see, and to the extent that we can, separate out cause and effect. I
understand. The Power Initiative that's just been announced by the President includes goals. We'll be setting goals for each of the agencies to reduce lost time and total case rates, to reduce the number of injuries that people have. But we've also included in that set of goals a focus on timely reporting of injuries when they do occur. And obviously that's a very good thing from several perspectives. We can't do a good job and address the kinds of problems you were mentioning earlier if we don't have the claim in hand. But another reason for that goal to be included is because we don't want agencies to solve the first problem by not filing claims that should have been filed. So we want to. The reason for having a goal for timely filing is to keep the emphasis on, yes, when an injury occurs, we want that paper to flow, or electron to flow to OWCP. We don't want people to dissuade injured workers from coming forward and solve their, reach their safety goals through a process that's inappropriate. Obviously, we are aware of that as a possibility. We try to stay in touch with it, and we do communicate with agency representatives, including the DHS and TSA folks who work with the workers' comp side of the House.
Been an actual reduction.
I'm sorry?
You think there's been an actual reduction then?
Of injuries?
Yeah.
Absolutely. The number of claims being filed with OWCP has dropped every year since about 2003 or 4. Actually, it rose in the early years in 2003 and 4, maybe in big part because TSA was ramping up, and TSA had a lot of injuries in its early days.
And
They have, however, as was testified to this afternoon, they have improved their safety record substantially, and they've improved their return-to-work efforts such that their lost production days, which were in 2005, I think were around 400 lost production days per year per 100 FTE. It's down to around 100 now. It's still a high number, but 400 was extraordinary. And so
that's because they're more experienced now. There's turnover there.
Several reasons. One is they've reduced the number of injuries. Lost production days can be reduced by just not having the injury in the first place. And
So they have been laudably proactive.
Yes, they have been. And the other thing you can do is get people back to work when the injury occurs.
How do you do that?
In the case of the agencies such as TSA, where the individual has physical requirements, it requires finding ways to split up the job, bring people back on sedentary responsibilities. In effect, it requires creativity on the part of management to find ways to reemploy people and to accommodate them. The same as management should be trying to hire people with disabilities in the first place and accommodate them. So that's a management responsibility, and I think TSA has shown in the statistics that they are addressing themselves to that.
Thank you, Mr. Hallmark. Ms. Seagraves, what is the reasoning behind disallowing the employees at TSA to wear personal dosimeters? Did you receive advice from any of the various agencies at DHS or the CDC, et cetera, on that regard? They apparently did wear some such before the federal government took them over.
Right. The responsibility for aviation security screening was performed by the FAA. And so, but even prior to the TSA and even prior to 9/11, the FAA removed the requirement for radiation dosimetry. So after 9/11, and of course whenever then TSA ramped up, then the radiation dosimeters were not issued.
But wait a minute. If an employee has his own dosimeter, you can't wear it anyway?
Well, it's not as simple whenever you to have an employee just go out and buy their own dosimeter. I mean, it's not simple. Unfortunately, you have to have control badges. We have to have a mechanism to be able to read that badge and then understand where that badge has been during the course of the individual's wearing. So, for example, if
it's their own personal device. So what do you care about whether or not it has its batteries, you know?
Well, but again, we would still have to have the control with that to be able to make a determination of the actual
I'm not asking you to use it to make determinations.
Okay.
If I want to wear it myself, why can't I wear it myself?
Well, what I'll say is the fact that in my capacity, my requirement is to do the proper assessments, do the proper analysis and evaluations, and to make determination whether or not radiation dosimetry is required. So if we are well below the occupational safety health dose limits, so if the individual wants to voluntarily wear one, then I would refer to my senior leadership then to make that decision.
So you don't see anything wrong with that, do you? I mean, that can't hurt.
But again, we would have no control over to the results of that dosimeter.
No, and that's what you'd say. If someone came running to you, you have a perfect answer. So from the employee's point of view, it looks strange. It looks like you don't want them to know. And of course, they can't know because their device is not being monitored by the federal agency. So as long as they know that it has no effect, it gives them some comfort, you know, like sucking your thumb, excuse me. But at least you have it on you, or maybe your wife insists that you do it even though she does not know what she is talking about. Why would the agency want to make trouble in that family by saying, now you're going to get fired if you take your own?
Well, and I'm not really sure that's been presented, that employees have actually been denied. I think, you know, at least from my standpoint, we have educated the workforce to tell them what the doses are and excuse me, what the emissions are from the
Would you
systems.
find out
and-
what the exact policy is on that, and within 30
Yes,
days, report
yes,
that to the
mhm,
committee?
I can do that, yes.
I'd like to go back to Dr. Howard. Could you advise the subcommittee on other federal occupations that would deserve or need close scrutiny for exposure concerns?
Well, the risk in the federal workforce varies by the exposure to biological, chemical, physical agents. So, for instance, in the public safety sector, where we have police, firefighting, correctional officers, other types of public safety officers, those occupations are at high risk, and there are a number of exposures that are important there. As we've talked about with TSA baggage screeners, there are a number of exposures, including radiation, that are important. So the general sector of public safety is one in which you look at injury and illness rates, and they tend to be higher than other occupations, so they deserve a lot of attention. And indeed, we have done a number of both health hazard evaluations and research studies in public safety, in firefighting, in police officers, in correctional officers, and others. So they are high-risk occupations in the federal sector.
I have jurisdiction in the committee I chair over workplace violations here in the legislative sector. And some may remember reading of workers in tunnels of the Capitol exposed to asbestos. It was shocking to members and staff to hear of this. I would imagine there are similar tunnels or pipes that have to be attended to and by other federal agencies and other federal workers. Do you know of exposure, for example, to asbestos, one of the legendary substances that is being taken down all over the United States with effects long ago that can't be rectified, but effects we see every day for workers charged with this task?
Well, certainly the situation that you bring up in terms of the Capitol Hill tunnels and asbestos exposure is one that at NIOSH we're very familiar with, because we were involved in advising the compliance office of Capitol Hill on those issues. But certainly in any workplace, federal or non-federal, the exposure to asbestos in place is a very big issue, and it involves a lot of
You
federal
have not had
agencies.
occasion to look at the rest of the federal workplace at these issues only here in the Capitol? And
We've had a number of HHEs in federal buildings that have involved possible exposure or potential exposure to fibers such as asbestos, yes.
I would think that would rank right up there with firefighters and,
Yes.
and others. Thank you very much. I see that the real chairman is back.
First of all, I want to thank Ms. Eleanor Holmes Norton for her kindness and her ability in conducting this hearing in my absence, and I really appreciate having you here and having you able to do this. Allows us to get much more done. I want to thank the witnesses. I apologize. We had votes on the floor, as you know, but I really do appreciate you coming before this committee and helping us with our work. Let's see. The questioning. In reviewing the testimony that was submitted prior to the hearing, I did note in the NIOSH 2008 report that researchers had observed covered agency stop buttons. In your view, based on those surveys done at the 12 airports, does TSA have a uniform lockout and tag-out procedure in place when transportation security officers or TSOs must clear these bag jams? And did it appear that the workers were aware of and were following those procedures? Is there any alternative approach here in terms of a suggestion for maybe improving the lockout, tag-out procedures?
Well, we certainly expressed concern in our report and asked TSA to look at that issue. We did not provide specific recommendations on alternative procedures, but we certainly don't think that the insertion of one's arm into an active machine is a good idea in any sense. So we were very concerned about that issue and made recommendations to TSA to provide instruments to remove baggage if they get stuck inside the machine and a TSA employee has to get the bag out.
Okay. Did they respond in any way that indicated that they might be moving toward that?
Well, certainly in our evaluation, we provide the recommendations to employees and to the employer in our HHE. We don't necessarily do oversight on whether the recommendations are implemented, so Mr. Seagraves may have an answer to that particular issue.
Were you at all able to, and this is completely something that came up in my discussion with some of the TSA employees about the new scanning machine, the total body scanning machine, and the number of X-rays that I guess they're tiny X-rays or very brief, but there's a lot of concern there among the rank and file, just the folks that I run into. I'm in and out of airports all the time, and there's a concern about, well, they realize it's not overexposure for the passenger, but for the TSOs that are standing there and conducting this hour after hour, they were concerned. I raised the issue with George Nakara at Boston, at Logan Airport, and he didn't seem that concerned, but I still felt that there hadn't been a really in-depth look at this. And you have any sense of what hazards that might present, or
well, certainly, from a radiation safety perspective, the issue would be how much scatter there is from the machine. Obviously, the passenger is standing there at the beam. So the question in any of these situations is how much scatter is there. If there's any scatter at all, then can you protect or shield the employee from that scatter? For instance, the baggage screening machines have flaps and it's enclosed. So in the body scanner, that would be the issue. We have not, NIOSH has not evaluated body scanners. We're happy to do so at TSA's request or employees' request, but we haven't actually done that kind of work yet. So.
Okay. Anybody else? Ms. Seagraves?
Yes, we have evaluated the AITs, both from a public dose limit as well, a dose to the public as well as our employees. And so there's an American National Standards Institute standard that we must follow to ensure the safety and health of not only the public but our employees. So the dose that are emitted from these machines are very, very low. And so when the employees are standing beside the machine, they are not receiving a dose. So we instruct our employees, there's an area around the system that has a mat with a yellow line on it, that we tell them just to stay away from that, or stay off of that, I should say, so that their radiation exposure is as low as reasonably achievable. In Boston, we have placed area radiation dosimeters on the systems up there, and we've started in April, and so we should hopefully have evaluation results on those shortly. But even with the surveys that we're doing, it's just background.
Yeah. Are you asking the TSOs to wear dosimeters or anything like that to,
No, there's no requirement to do so at this time, and that's why we're doing the area dosimetry. So.
Yeah. It might, it might actually help with confidence for the employees if we somehow allowed them to wear dosimeters and then allowed them to have an impartial reading of that to figure out if they're picking up REMs or any radiation. I think it would give them great peace of mind if they were able to become part of that process. You know, I think that might go a long way. I don't discount what you're saying in any way, but I think that it might be more convincing for the employees, and it might rule out any aberration that might be something that might be missing if it was actually on the TSO, the screener themselves. Okay, thank you. Now, would that be something legislatively that we would? I know TSA hasn't asked for it. You know, a more thorough screening process for the body scanners. Is that something that you would rather us do, or?
Oh, you mean as far as
Personnel.
the availability of dosimetry on personnel for
Yeah.
that operate the AITs? We can certainly take a look at that. You know, we're performing personal dosimetry at 6 airports now based on the recommendation from the National Institute for Occupational Safety and Health. So we can certainly look at that. We do have a start, though, with the area dosimeters placed on these systems, again, only at Boston, Cincinnati, and Los Angeles. So surveys and independent evaluations, you know, again, state that these systems are safe both for the folks in the public as well as our employees. But we
Okay.
can certainly look into doing some personal radiation dosimetry.
Would there be any enhanced vulnerability to, say, pregnant women, or, you know, I mean, that's one example, I guess, being exposed to that low level of radiation? Or is that there's something that might expose the fetus to that, you know, to danger, as opposed to, you know,
From the public or from the employee?
either?
Either? No, there is none. There's none. So
Okay.
again, we're following the American National Standards Institute standards that lays out the requirements for the doses of the system, and these systems are well below the ANSI standard.
Okay.
Yeah.
All right. Let's see. This one is this back here. Oh, okay. Yeah, I'm not going to go back on that. I wonder if you could describe the kinds of unsafe work practices that have been witnessed by NIOSH staff in regards to what were described as poor work practices. What, in your opinion, should TSA be providing its employees in terms of training and equipment to properly deal with the clearing of the bags, the jams that might occur?
Right, and again, I think there are two issues. One is proper training, because there's, I think, an importance to making sure that employees realize the risk of inserting their arm into an active machine before turning it off, etc. Having the proper equipment supplied by the employer to unjam a bag jam is extremely important, instead of using your arm to use an instrument. So all of those things are extremely important in making sure there's no unnecessary exposure. The flaps of the machine that you stick your bag through are protective. They act as a shielding for radiation, but when you violate that protection by putting your arm in it, that's a serious issue. So that's probably the most important practice that we would consider improper and risky that we would like to see corrected, and I'm sure TSA has paid some attention to that recommendation.
Okay, thank you. The subcommittee has heard some complaints about files being lost and misplaced or that are inaccessible. A document provided by your office to the subcommittee says that when an appellate body requests a case file, the electronic portion of a file is sent instantly, but the paper portion of that same file must be physically shipped. It seems that when a case file is requested, any paper portion of the file should be made electronic, and then the complete case file be sent electronically. What are the barriers to setting that type of procedure up?
OWCP started imaging cases around 2000, so we have about 10 years now. We did it prospectively, so all new cases starting then were imaged and are totally imaged. Cases which pre-existed, we did not go back and image all of the old files.
I see.
Basically, a cost-benefit analysis. We have many of the old files are very, very large, and we just couldn't afford to do that. The process. It's been our expectation that over time, the number of cases that have a split file, in other words, an electronic component and a paper component, would diminish, and that we'll get to the point where we do have a cost-benefit analysis that makes sense to do all the back imaging. We haven't gotten to that point yet.
Okay. We also got some data regarding appeals to the three